Greetings, and thank you for joining me for my weekly video message. I want to wish all those who recognize Diwali, the Festival of Lights, a joyous week of celebration that's also celebrated by Jains and Sikhs. I was happy to celebrate Diwali here at the Executive Office Building with our Indian community. Diwali celebrates the symbolic victory of light over darkness, good over evil, and inspires us to renew our commitment to doing what is right, equitable, and humane in the new year. Unfortunately, we could not gather in person last year for Diwali due to the pandemic, so it was wonderful to see everyone in person and participate in this joyous celebration. This week, we also recognized Emancipation Day in Maryland, which was Monday, November 1st. In 1864, on this day, the enslaved people of the state were freed because of a vote by Maryland residents that ended slavery. We were the first state south of the Mason-Dixon line to end slavery and to end it by a vote rather than by federal or military action. November is also Native American Heritage Month, when we recognize the history of indigenous people of this country and the struggles they had and continue to have. America's treatment of Native populations continues to perpetuate the grave injustices that they have endured for centuries. As demonstrated by the recent census, Montgomery County is one of the most diverse communities in this country, and my administration is committed to equity, engagement, and education. It is important to understand the histories and the contributions to our county by our diverse population. The more we know about each other, the stronger our communities become, and the greater the understanding we achieve between people. As for our COVID cases this week, we're a bit higher than we were a week ago, and we continue to hover between substantial and moderate transmission levels, according to the CDC. I was disappointed that the council, sitting as the Board of Health, chose to tie the mask mandate to a specific number of days. We had urged them to rely on public health guidance to determine the safest time to lift the mandate. However, the council has stayed with that approach, and that is causing some confusion. Currently, there is no mask mandate, but I would urge everyone to continue to wear masks when you are indoors in publicly accessible areas. The focus on fussing over this mask mandate is playing into the fears of extremists who are conflating a good health practice with limiting their personal freedom, which frankly is a bit absurd. Throughout this pandemic, masks have been critical to minimizing COVID spread. At this stage, because of our high vaccination and use of masks, we felt confident in relaxing some of our regulations in regard to the use of indoor spaces. With winter clearly upon us and more activities moving indoors, we do have to be aware that opportunities for COVID to spread will increase. Whether or not we have a mandate, wearing a mask and getting vaccinated probably remain the two most health-conscious things that you can do. Mandate or no mandate, let's be smart and considerate of others. A mask protects against COVID, but also against the flu and common cold. If you and your family want to avoid sickness this winter and fall, wear a mask. The big news this week is that over 100,000 Montgomery County residents aged 5 to 11 will now be eligible to be vaccinated. It's welcome news that the CDC has approved the Pfizer vaccine for children 5 to 11, and our top priority is to vaccinate our kids as quickly, effectively, and equitably as possible. I encourage all Montgomery County parents of 5 to 11-year-olds to vaccinate your children, rely on credible information and resources, and please reach out to your pediatrician, healthcare providers, or to our Health and Human Services Department if you have any questions or concerns. Both the county and private providers will be providing doses. It's important to note that we are not the primary distributor of this vaccine. 2/3 of the vaccine doses are going to other entities, including pharmacies, private physicians, and health clinics. The county began vaccinating children this week, and the county's clinics will offer special hours for vaccinations and school-based clinics on Saturdays and Sundays. I know many parents are eager to get their child vaccinated. If you're having difficulty getting an appointment, please be patient. For more information, go to govaxmocode.com. Having our 5 to 11-year-olds vaccinated will help us reduce the number of students missing class due to quarantining. On Monday, I joined the schools and health officials for a press conference to update changes to our MCPS quarantine guidelines. The changes are to help minimize the number of students out of school while also protecting public health. When our students returned to full-time instruction 2 months ago, it was a major milestone for the 160,000 MCPS children and their families. But as we all know, it has been difficult for our teachers, families, and especially our students. Recent data shows a 35 percentage point decrease in literacy readiness among second graders and a 26-point drop on math measures for fifth graders at the end of the 2021 school year compared to the year before the pandemic in 2019. And for low-income, Latino, Black, and English learners, this learning loss was even worse. As a former elementary school teacher, I understand firsthand how concerning these numbers are. This is why ensuring that our schools are as safe as possible so kids in school will continue to be a top priority. When I was with Dr. McKnight on the first day of school this year, I said, we must be prepared and honest with ourselves that this school year is going to be difficult, but we will make it through by working together. And those first couple of weeks, it was very difficult. MCPS had to, out of an abundance of caution, quarantine more students than we wanted to, upsetting parents and disrupting our students' education just as they returned. But as each day and week has gone by, students, teachers, and principals have grasped how to manage students better in this environment. MCPS administrators working with our HHS department diligently worked together to find solutions and best practices, found and deployed rapid tests, and ultimately reduced the quarantine numbers from more than 1,000 per week down to just over 100 in only 8 weeks. This is incredible progress, and we did it by working together, not just by blaming each other. I want to thank everyone who has helped with this effort. We believe that these new guidelines, which go into effect Monday, November 8th, will have a significant impact on the number of students required to quarantine. One positive outcome of the pandemic has been how this county has treated our homeless population. Prior to the pandemic, our county would only house the homeless during cold weather months. This was unacceptable, and quite frankly, it should have not taken a pandemic for us to do the right thing by this population. I'm committed to ensuring that this county not only continues to commit to our plan to end homelessness, but will always have a shelter available no matter what time of year it is. Unfortunately, our current county facilities supporting homeless sheltering and associated services are insufficient for the current population and future projections. And due to COVID-19, the maximum occupancy of each county homeless shelter has decreased in order to allow for social distancing and spacing of beds. The current facility that provides these services for men will no longer be available starting in the spring of 2021. Space and recreation centers that have been used to house men and women during the pandemic must be replaced so the recreation centers can reopen once the pandemic ceases to the point the programs can be resumed. Recently, I toured the construction of a new homeless shelter, a 2-story building located in North Bethesda to provide congregate situations, meals, and medical and case management services. This 30,000 square foot building will provide 200 beds as well as bathing, eating, computer, and administrative space. This facility will provide a full complement of homeless services for men seeking emergency shelter in Montgomery County. I'm very proud of the progress we are making, and I want to thank our Department of General Services and Health and Human Services, whose teams are working tirelessly to get this facility open as soon as possible and to help this vulnerable population. This week I celebrated my 72nd birthday, and I want to thank all of those of you who wished me birthday greetings in person and online. I've lived in Montgomery County since I was 10 years old. I've seen this county grow, diversify, and become one of the nation's most sought after and innovative jurisdictions. I'm very fortunate and humbled to be leading this county during one of our most challenging times in our history. It is uplifting to see how many have united as a community, been guided by science, and dedicated to equity, charity, kindness, and to become one of the nation's best places in dealing with this pandemic. Our success is not a surprise to me, and I look forward to celebrating more of our county's successes in the coming year. Thank you, and have a good week.